Hello and welcome to the Dementia Doctor. Today I have a very special guest and my mentor, Dr. Thomas, here with me. I'm so excited to have her. So, Dr. Thomas, could you please introduce yourself?
Sure. Hello, everyone. My name is Dr. Desirée Thomas. I am a general neurologist and I work in Houston, Texas. I was actually pretty much born and raised in Houston, and so I'm really familiar with the community and always happy to help families and caregivers to navigate this crazy journey.
So, one of the questions we have for you, Dr. Thomas, is how do we help our caregivers better support and advocate for their loved ones who are having dementia or memory problems?
So I think one thing that's very difficult at the time of the visit, sometimes we don't have as much time during the visit as we would like, or we're trying to respect the dignity of your loved one. So we can't always directly talk about some of the issues you might have noticed at home. So I think it's important to find ways to get the information to your provider. A lot of my patients will message me through our portal, and that's very helpful. They'll message me a day or two before the appointment and just give me a rundown of what's been going on. So that's helpful. And then they often have to remind me at the time of the visit, so did you happen to look in the chart? And that's how they kind of key me in to
Yeah.
look in the chart and see what I said.
Yeah. And sometimes if I miss them, these messages, they
Uh-huh.
will say, "Oh, I sent you a message
Yes.
yesterday," and
Yes.
that way, or they might say, "I sent you a summary of medication list,"
Mm.
and that way I
Yes.
pay attention. Sometimes I'm slipped some kind of paper
Yes.
at the end of the visit, or my nurse is told about these things, and in no way we are meaning to disrespect the family, but we're trying to get all the information we can get to make the
Mhm.
patient who is suffering from memory issues get the best care they can get.
Yeah.
Yeah.
And so sometimes what I'll do is, based on that list, I'll find ways to work it into the conversation so that it's not really clear to the person where the information's coming from. But I do want them to feel like they have an opportunity to voice their side of the story. So, for instance, if someone tells me that their loved one misplaced something or they left the stove on, I will say something like, "Yeah, a lot of my patients sometimes they leave on the stove. Has that ever happened to you?" And try to work it into the conversation.
Yeah. I think I've even said that I have left the stove on
Mhm.
once. It was very scary, but that kind of humanizes it, normalizes it a little bit.
Yeah,
I
that's
think
true.
it comes around some of the issues which, as you said, are closer to independence, dignity. So driving is a big one where
Yes.
if the family has concerns, it's such a sensitive issue. So how do you help your families navigate that issue when they bring this up to you?
Yeah, I think the main thing is just making sure that they understand that we're all just trying to take care of their loved one. And for the patient, for me to make sure that they understand that, sometimes their mind is not going to remember things, and that's okay. And that's what we're all there to help them. I often, when people feel that maybe their caregiver is being the boss of them or they don't like the role reversal, we'll talk about how hard that is to navigate. And I always tell them that it's better to have too much love than not enough love. Because I'm sure you have patients that maybe they don't have that many family around to help. And so it's better to have too much than too little.
I've never thought about it that way, but I've had some individuals where there was no one to care for them, and it
Yes.
was very tricky for me to be able to provide that support because I need someone to help me get there, and if there's no one, then how do I help them? And yes, that's a way to put it. That having some kind of support is helpful. I also find that it's a little bit trickier, especially when someone has been in the role of caring for the family. So they were the ones who,
Yeah.
like the woman who held the family together, and
Mhm.
now she's having memory changes, and suddenly, as you said,
Mhm.
role reversal. Now her children are saying, "Well, mom, you missed this," and she might find it very strange that
Mhm.
now
Right.
her children are telling these kinds of things about her, which she's not seeing. So
Yeah.
yeah, and the other place where I see this a little bit, where families feel a little uncomfortable discussing it with their loved
Mhm.
ones,
Yeah, that's true.
is mood issues. So
Mhm.
any kind of depression, anxiety, agitation,
Mhm.
anger, irritability. And I also see it in a different light with spouses, right? So I, I,
Yeah.
I, I think you see that as well in the clinic. And how
Yeah.
do you how do you talk to families about that? And what is your recommendation? How to kind of bring this up with your doctor or neurologist when you see them, if your loved one is having these mood issues?
Yeah. Again, sometimes it's a difficult situation because the person will deny that those things are happening, but you have been seeing it at home. So I think just during the visit saying, mom or dad, I've noticed that, you've been down a little bit, just trying to bring up the symptoms. And then I think that most neurologists were good at reading the room and seeing what's going on and then trying to draw that out of the person. But I think those things, that's really when it's important to either slip us the note or to tell us ahead of the visit so that we can find a way to work it into the conversation. The other thing I would say is that sometimes if there is a lot of love in the family, a lot of people, it can be a little bit overwhelming if there's too many cooks in the kitchen per se. So sometimes it's good to have that one person that's the main go-to person, so that way we can have kind of clear communication. And then if you are that one person, sometimes you do need to rotate that role because, trying to do it all yourself all the time, that's not, good for you.
Yeah, and I also want to hear your perspective and how you counsel caregivers, because sometimes it stops being a one-person job once the dementia progresses too much. That's how I put. But how do you counsel your caregivers? Because it's a situation where people feel very guilty of asking for support and help.
I think sometimes people feel guilty, but sadly, sometimes there is that go-to person in the family. Unfortunately, I've felt that way sometimes in my family because I'm the only physician. And so people really lean on me. And so sometimes I think, well, who am I supposed to lean on if I need help? And then sometimes you also, maybe you can maybe not completely delegate to them, but just give them something small, because a little help is better than no help at all. So just realizing your own limitations, but it's so important though not to try to do it all by yourself.
Yeah, delegation is the key. So even if you're doing
Yes.
a lot of things, if you find that you're getting close to being overwhelmed, then start delegating,
Yeah.
identifying family members or other caregivers, helpers or assistants, whatever you may want to call other helpers,
Yes.
to delegate some of the things off your plate. I also see that sometimes families will say, well, I can do that. And I say, yes, you can do that activity, but
Yeah.
at what cost? Is your own health being affected because you were doing that for your mom or dad? And would that free up some of your time?
Mhm.
And what are the challenges? Because finding a caregiver or a helper is so difficult for our families. And what do you recommend to families who come to you and say, how do we find a caregiver?
Yes. So I think it's just like when you have a little one and you have to find a daycare, you want to make sure it's somebody that you trust that is going to take care of your child the way that you would take care of their child. So the same thing for your loved one. Asking around, sometimes through your spiritual care organizations, that's a source. Sometimes your provider might have ideas. Of course, social media, being in a support group with other people that are caregivers that can give you ideas. But just asking, I think that's the first thing. Sometimes people do want to do this all by themselves. But there are a lot of resources. It's just looking for them. I think sometimes that when you're a caregiver, you're tired, and so the idea of having one more thing to add to your plate can be difficult. So that might be the thing that you delegate to another family member. You can give them that little piece to help you figure out, so that you don't do it by yourself.
Yeah, no, that's great advice. Some places we have, like the hospital system I work, I actually came across an organization that helps with caregiving. So I was just fortunate to walk into that and have that association and refer my families to that particular organization. But a lot of times it's almost like finding the right person, not the partner, but someone who can work with your loved one very well. One of the issues that I've noticed is that people will delegate that person the hardest task, and it often involves like bathing and showering, which can be very private. So, do you counsel your families like how to build in how to bring in this person into the family, and how to introduce them gently to your loved one?
Yeah, I think finding the right person, but sometimes I find that for some of those personal tasks, sometimes people prefer someone that they don't know. It's more embarrassing if it's somebody that they're familiar with. So sometimes introducing them as someone that's just like when you go to the hospital and maybe the nursing assistant has to help clean you in the hospital. Sometimes it's helpful to have someone that you don't know super well, but over time, most of us with our caregivers, we develop a relationship. So they may start off as a stranger, but eventually they're also going to become part of your family. So I think that's just something that's just tough for everyone to navigate. Most of us, that's just such a, we like to be independent. And so in order to have someone else help us, but it's the circle of life. We all are we needed help when we were little. We need help as we get older. So it's just something that we have to learn to accept.
Yeah, and that's one of the, you touch it so beautifully. That's one of the places where dignity is brought up informally, so to say, when someone else has to clean you, bathe you, dress you. And I've had those conversations with families where actually the daughter will say, well, that's my dad, and I would rather have another person help him with his hygiene rather than I do it. So it actually helps the families in those kinds of situations.
I remember when my son was born, I had a daughter first and then a son. And I thought it was going to be kind of strange to, again, I'm a girl and he's a boy, which sounds silly now that I'm saying it out loud. But the same thing, like somehow when you're a caregiver, you're a caregiver. And so sometimes the gender doesn't matter as much. So sometimes that's a way to think about it too.
Yeah. And I have people in all capacities and people in all different stages of caregiving. And it's also such a unique concept that we start assuming someone is a caregiver, or the family starts assuming that's not probably a role that they wanted to take, but it's kind of like put on, like so.
Something else I thought we should touch on is that sometimes I'm the kind of person where I will often do things myself because it's quicker, but sometimes we take too much. Our loved one actually can do a lot for themselves still. It may take a little bit longer, it might not be on our timetable, but they can still do for themselves. So trying not to take too many things on when maybe the person actually could help a little bit more.
And that way they might feel more involved and engaged in the process. So say if you're helping them shower, you can say, okay, mom, can you help me unbutton those buttons? And I do see this very specific difference between women caregivers and men caregivers. So where women caregivers will go to the limit of almost burning out, and difficulty with delegating is what I see with women. On the other hand, similar but a different psychology behind men caregivers, where they will be the man of the house and will do everything and will not ask for help because they're tough and strong. So it's kind of where I have to gently kind of talk about that the caregiver is actually as important as the patient that I'm seeing or the family member that I'm seeing with them.
But shout out to the male caregivers, because a lot of times we do think about women as being the caregivers, but some of my most devoted and doting caregivers have been a male in that role. So it's so important to have all of it.
Yes, and I feel like working in memory clinics has been something that brings true joy in places where I see people taking the marriage vows in disease and health, and I see that coming to life in disease, and I see these male or female caregivers loving their partner in unimaginable ways, to an unimaginable extent. Do you have any other parting message for our audience, Dr. Thomas?
I just think that it's just such an honor to take care of patients, and I think we learn from each other. My parents are aging. My mom actually already passed, and I had to work as her caregiver for a while, and my dad is starting to have his own issues. And so what I am helping you with is something that I get tips from you as well. So it's a two-way street, you know, in this role, and I really appreciate it.
Yeah, as neurologists, sometimes when we are talking to you, we are almost talking to ourselves and counseling ourselves that it's okay to get help, and we are all human beings, and we all need support and love from each other. Thank you so much for coming to our channel.
Yes, thank you for having me.
Thank you.